The Theatre Hub is a comprehensive, automated, pre-operative history-taking tool. It is a free-to-use service for surgeons and anaesthetists in any setting, government or private, inpatient or outpatient, emergency or elective. It can be accessed via the Google Play Store, the Apple Store, and online as a web-based service. It can be used on mobile devices, tablet devices, laptops, and desktop computers. The PAC, or pre-anaesthetic questionnaire, is an adaptive algorithm that triggers further questions depending on the patient's input. It is not an AI-based system. Instead, it relies on predefined logic. A low-risk patient with few to no comorbidities can complete the form in under 6 minutes. There are 10 core pages covering universal clinical parameters, including allergies, medical history, surgical history, medications, anesthetic history, fitness, and substance habits. The medical history pages trigger an additional potential 19 pages, providing more insight into such common and serious conditions as diabetes, stroke, and cancer. By using an active opt-out rather than an active opt-in approach, a legal onus is placed on the patient to disclose listed conditions that they may potentially have, rather than an onus on healthcare providers to ask the necessary questions in order to trigger responses. When a patient reports a history of stroke, for example, an additional page asks when the stroke occurred, what the cause was, what treatment was provided, and what the current status of the patient is now. A stroke that happened within the past 3 months then triggers a red flag alert on the provider's PAC report. A stroke that happened more than 3 months ago and less than a year ago triggers a yellow flag. Red flags signal potential action, yellow flags signal awareness of an issue. There are two versions of the system, a full PAC and a quick PAC. The full PAC allows the patient to log in and out and access their medical data repeatedly and for different operative events. In addition to the clinical questionnaire, it also features the capturing of demographic data, which can be shared with specific providers. It allows for the upload of information such as blood results, radiology reports, and any other relevant clinical information in both image and document format. Workmen's compensation coverage patients are given the opportunity to upload their WCL2 forms, their identity documents, and their first medical reports. Once the system identifies that the medical questionnaire, the personal information, and surgical booking are complete, it allows patients to proceed to complete the consent form and authorize the sharing of their information. If the patient is linked to their doctor, the consent form they are presented with is a personalized version and can be a surgical or anesthetic form or both. Alternatively, they will be given a generic anesthetic consent form to complete. If the patient's doctor is a Theatre Hub subscriber, the system links patient and doctor, allowing the patient to view in real time any updates to their theatre list booking and allowing the doctor to view the completed PAC electronically as well as any updates to demographic information. If the patient's doctor is not a Theatre Hub subscriber, the completed PAC will be emailed to them on provision of an email address by the patient. Alternatively, the patient has the option of printing out their PAC and providing it to their doctor in hard copy. The full PAC can be accessed in one of two ways. If the patient's doctor is a Theatre Hub subscriber, they can load a surgical booking onto the Theatre Hub system and share a unique reference number with a patient undergoing the operation. The patient clicks on I have a reference number, which automatically links them to their doctor and pre-populates their surgical booking. Alternatively, without a reference number, patients can register on the system and provide details of their operative booking themselves. Once they have found their doctor on the system and given permission for the Theatre Hub to share their information, they are then linked to their doctor. If their doctor is not on the system, they are still able to complete the full PAC and email it to their doctor or make it available as a hard copy. On the other hand, the Quick PAC is designed for rapid use and bypasses the registration process. It is designed for use in emergency settings where a full PAC would be too time-consuming. It is the equivalent of completing a paper-based anesthetic form. It includes the adaptive questionnaire and a generic consent form only. The patient's Quick PAC access will expire once the Quick PAC is shared or after 1 hour, whichever comes first. The Theatre Hub is very serious about protecting its users' privacy and information autonomy. From a security point of view, all personally identifiable information is fully encrypted both in transit and at rest in the database. This means that all medical information remains anonymous at all times. Access is made available only to those providers that the patient has expressly given consent to share their data with. The TheatreHub patient portal is a non-remunerated app and does not permit advertising or non-medical third-party involvement. The goal is to enhance communication, improve data accuracy, and make the pre-operative experience overall more efficient for providers and for patients.